My name is Nina New Sanford. I'm an assistant professor in radiation oncology at University of Texas Southwestern. So as a radiation oncologist, I care for patients with cancer who need radiation therapy as part of their care. So radiology is reading images, whereas radiation oncology is using radiation to treat cancers. I was born in Beijing, China. I immigrated to the US at the age of 3. My mother's career inspired me to also become a physician. As an only child, I often talked to adults, and I really enjoyed getting to know different kinds of people. It was that personal interaction that really drew me to a career in medicine. I was probably around middle school when I first decided I might want to pursue a career in medicine, but it was more a gradual and growing interest. I chose to study cancer because I find the biology of cancer extremely fascinating, and also caring for patients with cancer really provides me an opportunity to have very meaningful interactions with the patients and their families. Gastrointestinal cancers involve the liver, stomach, and intestines. My favorite STEM subject in school was math, and I was captain of the math team in middle school. I use math almost every day in my job now to calculate the radiation dose and design radiation plans for patients. In college, I decided to major in Spanish. I was able to spend a semester abroad in Madrid. During that time, I had the opportunity to volunteer at a local hospital. My interactions with the patients there motivated me to pursue a career in medicine. I think as an oncologist, it's really important to understand patients' goals of care and their personal preferences in terms of their cancer treatment, and having a multicultural background has certainly helped with that. Within oncology, as doctors, we have to follow national guidelines for care, but there is flexibility to tailor treatments according to patients' preferences and values. For example, radiation therapy often requires daily treatments. For patients who are coming from afar, we can design shorter treatment courses for them. So on an individual level, I aim to improve the quality of life and extend the life of my patients with cancer. A lot of times patients diagnosed with cancer have other challenges, such as securing safe housing and finding childcare. My job is really about helping the whole patient. In addition to caring for patients, I'm actively involved in clinical research with a goal of improving treatment outcomes for patients in the future. In addition to being a doctor, I'm also a mom of 2 young girls. I think balancing being a doctor and a parent is certainly challenging, but I'm fortunate to have a very supportive spouse and also a lot of family in the area, which has been very helpful. One of the most challenging parts of my job is caring for young patients who are facing a cancer diagnosis, and also patients with young children. If we support a woman in STEM, then she can change the world.